Okay, so today we're going to be talking about hoarding and health. My name is Austin Porsborg. Alright, so here's an outline which is going to give you a better idea of how the presentation is actually going to flow or whatnot. First of all, we're going to talk about what is hoarding. We're going to go over hoarding versus collecting, and we'll talk about what causes people to start this habit, the different forms of hoarding, stages associated with this disorder, as well as the effects, the mental health, the physical effects, the psychological effects, how it affects your family, and the different therapies that are offered for hoarding, as well as trying to distinguish whether or not hoarding is a new disorder or whatnot, or what's going on with that. Alright, so first off, what is hoarding? And hoarding is basically the excessive collection of items along with the inability to discard them. And this can result in cramped and cluttered living quarters, poor mental health, unsanitary living conditions, limited or no social interaction, as well as shame or embarrassment. So hoarding versus collecting, they're two very different topics. First off, hoarders, they typically save random items, sometimes with little to no meaning, typically in things from daily life, and they store these items in a very disorganized manner. Collectors, on the other hand, deliberately search for specific items for a collection, and usually categorize these items and carefully display them. So why do people start to hoard? People partake in the act of hoarding for several reasons, including they feel that these items are what are going to be needed in the future, so in a sense they have some value. They also have emotional significance, so they have basically emotional ties to specific items or whatnot. And all these items, when you're surrounded by this, the environment that you create, it creates a feeling of safety. And the other reason why they do this is because it's pathological, so in a sense they don't really know they're doing this. So for the different types of hoarding, we have three different types. We have OCD based hoarding, which is like you would see in the bottom hand corner with the beer cans. And hoarding in older adults is very common, and that is a pretty good description there with the woman in her kitchen or whatnot. And the reason why they have an actual type of hoarding is because for older adults or whatnot is because there's a lot of older adults that partake in this particular disorder. And then they also have animal hoarding, and that's a whole different area of hoarding or whatnot. And the bad thing about that is it goes in and basically affects two different things. It affects not only the individual, but the animal as well. And this results in really unsanitary living conditions and just a really bad environment in general. So it's one of the worst forms of hoarding. Alright, so here are the stages of hoarding. First off, you have a mild stage, which clutter. It basically results in having difficulty throwing things away. However, it doesn't really affect your life because it hasn't really got to that stage yet to where you're just in complete chaos or whatnot. And it usually begins in the early stages of teenage years. In the late stage, basically it primarily affects the elderly that have other disorders already, such as dementia, depression, or participate in substance abuse. And the reason why it's considered late stage as well is because they continue to acquire things regardless of knowing that they have nowhere to put it. So that kind of defines that. Alright, so for hoarding and mental health, hoarding is very common in individuals suffering from a major depression disorder, anxiety, and attention deficit disorder. And studies have actually found that the frontal lobe within the brain works differently. So that would be the example here, the pink the pink color on the brain towards the frontal cortex of the region. Basically, this results in changed priorities and lack of rational decisions. Some past perceptions of hoarding would be they're kind of outgrowing the idea that it's completely related to obsessive compulsive disorder, because they think it's actually a disorder by itself, even though it takes some characteristics from that. And the other reason is because they have very different treatments that have been realized to be effective or whatnot. Some of the OCD treatments that they do on hoarders are actually not as effective as they could be, so that's why they kind of want to diagnose this as a different disorder or whatnot. I'll get into that a little bit later though. So here are the physical effects of hoarding. You have unsanitary living conditions, and this basically results in keeping old food until it decays, causing mold and other bacteria to grow and spread throughout the house. You also have large quantities of items. It makes it hard to clean. It also increases the fire risk due to excessive items. You have dust particles that accumulate, and this contributes to respiratory infections and asthma. And rodents and insects are also a big part because they typically carry diseases, and small children become at risk of infection if they get bit or whatnot. So for psychological effects of hoarding, these basically include increased compulsive behavior. So it's total normal collections or interest can result in excessive or pathological behaviors. And they also have a feeling of isolation, which is the most common. And this can basically result in friends and family often refusing to come visit because of health and safety concerns. Another psychological effect would be depression, anxiety, anger, or grief. Alright, so how compulsive hoarding affects families. Does this in a variety of ways. Not only constant clutter can make others feel trapped, because of, let's just say you live with a family and they want to move the furniture or whatnot, or they want to get rid of some things, and when you don't allow them to do that, they feel trapped in a sense because they really have no say in what goes down in the household. Hoarders also become very possessive of their items, so they don't want you to touch or move anything. The lack of cleanliness can also affect the families. The lack of team decisions, much like I mentioned about moving the furniture or having any say of what goes on in the house. Social life. Maybe they're embarrassed to have their friends come over because the house is in such chaos and they're kind of embarrassed of their living environment. So it can really affect their social life in that aspect. Distant family members, like I mentioned before, having friends and family, refusing to come visit because of healthy and safety concerns. Embarrassment kind of comes self-explanatory, as well as debt. And debt can basically occur due to compulsive buying. And when you compulsively buy these items and you basically store them at your house and make a massive collection of items that you really don't need. Alright, so the different therapies for hoarding, cognitive behavior therapy. And this is kind of a new light. It's kind of a new idea, a new approach to the treatment of this particular disorder. And this is focused on changing former behaviors, establishing these individuals to make more reasonable judgments, having them make quick decisions. So basically, whether or not to keep an object or to toss it, and then also to practice discarding items while sorting through intense emotions, that they trigger or whatnot. So motivational interviewing is also an aspect of the different therapies that are offered, and this inspires change and basically individuals to stay on track. Group treatments kind of brings out the idea that you are not alone or whatnot. They also have harm reduction hoarding, and it's because most hoarders don't seek out help and they have trouble changing it, and this can basically help cut down costs on vermin, not cut down costs, but down on vermin itself, fire hazards, the risk of falls, and other threats to the community. So is hoarding basically a new disorder? That's what they're trying to figure out. Basically a study was conducted that emphasized how hoarding is closely related to OCD and OPD, but it expressed the need for a new classification in order to more accurately categorize individuals. Basically this was occurring because compulsive hoarding seems to frequently be independent from other neurological and psychiatric disorders, including OCD and OCPD, and what the positive benefits would include would be increased awareness, improve identification of cases or whatnot, as well as stimulate research and develop of specific treatments for this particular disorder. That way they're not wrongly diagnosing these individuals, and they're able to get a much better outlook on exactly what their problems are, as well as really focus on how to treat this particular disorder, because there's not a lot of stuff out there besides the cognitive behavioral therapy or whatnot. So here are my questions. Question 1, if you had a family member that was a hoarder, how would you handle the situation, and what methods would you use to get them to change? Question 2, how can hoarding affect someone's life from a mental and physical perspective? Question 3, how do you think hoarding should be classified as a new disorder? Or do you think hoarding should be classified as a new disorder in the Diagnostic and Statistical Manual of Mental Disorders? Why or why not? And here's a list of my references, and thank you for your time. Sorry I had to talk so fast, I just had a lot of slides to go through. Thank you.